Greetings, everyone. Welcome to this edition of Your Good Health, a program where we will be taking a look at some of the medical and health issues affecting you, your family, and your communities. Joining us in the discussion today, we have Nurse Lisette Recinos and Nurse Deborah Mariano. Ladies, nurses, good evening. Welcome to the program. Let's start by introducing yourselves. Tell us who you are. Let's begin with Lisette. Tell us who you are.
I'm a public health nurse at San Antonio Polyclinic. That's a rural part of Toledo. We serve about 23 to 25 rural villages, and we offer medical services. We offer maternal services and other support services. I've been in the ministry from 2001, then we entered 2011. And since 2011, I've been the public health nurse at Isabel Palma Polyclinic.
All right, and let's get Nurse Deborah.
Good afternoon. My name is Deborah Mariano. I am the senior public health nurse for the Toledo district. I have been in the ministry from 2000, and I have been a staff nurse midwife prior to becoming a public health nurse in 2011. And 2011, I got enrolled as the public health nurse for the Punta Polyclinic. And 2016, I was promoted to the senior public health post at the Punta Polyclinic. We also serve Punta Town and 26 other rural communities. We do maternal and child health, and we do home visits, school visits, and we do other like chronic conditions. We deal with patients like that. And we also do mobiles in the communities that we serve.
Now, the whole world, if you will, is under a global pandemic, and Belize is no exception. We continue to be affected by the coronavirus. How prepared is the Punta Gorda hospital and the health services here in the Toledo district to deal with this global pandemic?
Okay, well, we know that the coronavirus, the COVID-19 is a pandemic, no? The whole world is faced with this virus. We have been doing, prior to having cases here in Toledo, the ministry have been doing ongoing trainings with staff. We have been doing donning and doffing, that's putting on the PPEs and knowing what to take off first before taking off whatever else, because a little mistake and you can become infected with the virus if not done the proper way. We have also been doing training in other areas, especially knowing more about the virus. All right, that's very important. We have to know how it is transmitted. We have to know who is the host, things like that. So the ministry have been doing ongoing trainings. Even now that we have cases, we still continue to do our ongoing trainings. And we have mobiles that a team would go to the different communities to do swabbing. We are doing the rapid test now. We are still doing the PCR, but the PCR will take a little while to get the result. But the rapid test, 1 hour, 2 hours, the result is ready. So we have been doing a lot, and I think we are fairly ready when it comes to the pandemic, the COVID-19.
When it comes to the way things are done here in Toledo, give us, if you will, a snapshot or a procedure. Do I just show up at the PG hospital to say, okay, come test me for COVID?
No, usually if somebody is having signs and symptoms, that person would call in. You would call in, and then a team would go to your home to do a swab. If your swab comes back positive, then the team would go back in the home and they will do everybody else in the home. They will do swab for everybody else in the home to see if other persons in the home is positive also. Mm-hmm. You have people that comes in contact with somebody that is a case then. You call that close contact. That person, if that person reached to the flu clinic, that person would be swabbed. And then contact tracing will be done to see who other else might have been infected by this one individual.
Now, you mentioned just now about a flu clinic.
Mm-hmm.
Explain to me in the terminologies. There's a flu clinic. then there's a dental clinic, then there's a mobile clinic. Then how do I know which is which?
Which area to go? Okay, the flu clinic caters for anybody that have flu-like symptoms that can be related to the COVID virus, the COVID-19 virus. So if you are having fever, if you are having cough, if you are having cold, diarrhea, abdominal pain, headache, conjunctivitis, all of these are associated with the COVID-19 disease, then you go to the flu clinic to be checked out.
And that clinic is located where?
That clinic is located right on the hospital compound, between the hospital building and the NHI building, right to the back.
Okay. Now, another thing that we might want to look at is the whole issue of who gets to go to the flu clinic. Do I just show up again, or do I need an appointment to go there? If I come down sneezing, watery eyes, runny nose, that kind of thing, do I just go there, or when do I go to the flu clinic?
Okay, we have a PCA, somebody like a nurse, no? That is outside in the front of the NHI building. When anybody reached to seek service, she would do a little triage with them.
Okay.
All right? She would ask them, you have any cough, any cold? Do you come to see doctor? What is happening to you? And that person is the person that would refer the patient to the flu clinic or inside the NHI building.
Okay. So it's not as you get there, and then when you get there, then somebody will take control right at the entrance.
Yes.
And then direct you to where you need.
Direct you to where you need to go.
Okay. Are children allowed in at the hospital?
You mean the hospital building where they have inpatient?
The compound. Can we? If I go there to do my check, can I bring my child if I?
Because of the pandemic again, if the child is not sick, we don't encourage the mothers to bring the child to the compound. Because COVID is something that we can't look at you and say you have COVID. Some people have no signs and symptoms. And if somebody have COVID and you go around them and that person is talking without a mask, you are in close contact with that person, you could develop the COVID just by the droplets.
Okay.
You understand? So we encourage mothers, if the child is not sick, don't bring the child to the hospital compound.
Okay. Now, talking about the mask and the droplets and what have you, we're in a studio setting and everybody is seeing that you all are wearing your mask, but I am not. And just to explain this for me, I think I am at a safe distance. I am more than 6 feet away from you. So even though I am speaking and you're speaking, I don't think that there's a risk of the droplets reaching. But just explain, just in case, because I know we will have viewers who will say, well, the nurses have their mask on and Mr. Jones in the same studio doesn't have a mask on. So one of you could explain that for me so that I don't get into trouble with the viewers.
Okay.
We know that the recommendation has been from the start of this pandemic within Belize that we need to keep at least 6 feet distance. So right now, I am not 6 feet apart from nurse, so we need to wear our mask. Now you are more than 6 feet apart. So it's because whenever we speak, we project droplets, right? And so while they have done testing, they have found out that the droplets can go as far as 6 feet. And so this is a recommended distance that you should keep away from persons, especially if they're not wearing a mask, to reduce the chances of you getting any of the particles. Right?
And just for the benefit of our viewers, will know that even though you are nurses, after you leave, where you are sitting and the table, the microphones will be sanitized.
Right.
So the next set of guests coming in the studio won't be exposed.
Right.
I'm not saying that you all are positive, but we have to treat everybody as if though they are. Right? Now, in terms of coronavirus, COVID-19, we hear of different treatments. People talk about they can use the herbs. I know of people who go into the bush looking for this little purple flowers or what have you to use. Vervain, yes. What is there to treat COVID-19?
From the beginning, we know that COVID, the virus, it attacks our immune system. So anything apart from doing medical treatment, we need to boost our immune system, right? And there are so many things that we can do, right? But apart from that, we need to also remember that I will bring up the name about the Ivermectin treatment, right? It has been everywhere on Facebook. in any social media space, right? First, it was not something that we heard from the ministry, but the ministry has now come and informed the public that it's been part of the protocol for management of patients, and there's a series of illness from the mild to the moderate to the severe cases that the treatment has been given. One of the things that I must say that consumers need to know is that every medication we take has side effects, and ivermectin is no different. And I would say even ivermectin would have even more, right? Because there are a lot of conversations, a lot of discussion have come to different spaces, different social media spaces about ivermectin, a lot of controversial discussions, right? But what we want the public to know is that we need to be careful what we buy over the counter. We need to ensure that we at least get a medical evaluation, that you get a medical checkup, that you consult with your physician, your doctor before, right? So that, because we have people who have chronic conditions, diagnosed and undiagnosed, right? So we need to be careful. We have children, we have adults with chronic conditions, so we would just want to advise people to be careful because even Tylenol has side effects,
Yes.
right? And we take Tylenol hand over fist, how the population would say, right? So it's just for us to be careful. It is there, yes, but just for us to be careful how we take it.
Now, let me ask you to explain some more about this ivermectin, because a lot of people will be familiar with it, used to treat livestock. Is it the same ivermectin that I can take for COVID treatment?
I know many people have been taking the injectable as a orally, right? It's not something that I would say the ministry recommends, because within their protocol and their management, it is specified that it has to be taken per weight, for body weight of each person. And like I said, each person has to be given an evaluation, because many people suffer from conditions, and we know that medications, when the level is too high, then we end up with toxicity, right? And it also affects our system. So it is there, right? But it should be taken under caution, right? And also by the recommendation of your physician, right? So it's not the same. It's not the same that the ministry is giving that you get to buy over the counter.
Okay.
The one the ministry is giving is the oral tablet. Tablets.
Okay. And so for those who have been buying it over the counter, maybe at the drugstore or an agrochemical place,
Right.
can they now stop going there and come to you at the hospital to buy the one that won't be harmful?
Well, I know that it is under the ministry management. There is a prophylactic that you can take it prophylactically if you have been exposed, right? You can take it prophylactic. What I would suggest to the public is come and see your physician and explain to them the exposure that you think you may have had, and by no means they will not hold it back from you, because we actually have it. We actually have it in country for frontline workers, for people who are ill, for people who become positive, and also for people who may think themselves to have been exposed.
Now, is ivermectin, is it prescribed or is it used to prevent COVID-19? Can I take it as a regimen so that I don't get the virus?
That is why we say prophylactic. That means you take it to prevent it, right? It's a preventative measure. Just like for us, we're going to be taking it prophylactic because we become exposed to patients who are positive, doing surveillance, having them been taking care of them in the clinics and the mobile clinics. So there is a space that we can get it prophylactic to prevent. Yes.
What do you say to the persons who, like speaking for myself, I know that I am allergic to certain medications. Is it safe for somebody to be taking not only ivermectin but other medication without the advice of a doctor or a medical practitioner?
I wouldn't think it is safe, just like with any other medication, right? We know that people who are chronically ill who take a series of medication. And these medications from time to time have to be reviewed and revised by a physician every 6 months, every year. So likewise with adding ivermectin to that, I am sure that people need to be even careful, right, on taking medication, taking an additional medication, right? Because sometimes when you take medication, they have the combination of them will cause an adverse effect.
Yes.
Right?
Okay. Now, I don't know which one of you will take this, or maybe both of you, I can get an opinion from you. We spoke about ivermectin, and we know of people who are trying to take all the fever drugs they could find, the Vervine, they're taking all of that they can find. What is your advice? What can I do? What can the ordinary folk at home do? Do you tell them not to discontinue the fever grass and the Vervine? What's your medical advice?
Well, in a way, because they said that it's good to take, because they said that the fever grass is the cure for the virus, no? I wouldn't discourage people to say don't take it. But like any medication, herbs, you get the full dose of everything that is in that herb. Yeah. Remember, when you take medication prescribed by a doctor, these medications were herb before, but these medications go through a process that the toxins are taken out. The fever grass, the Vervine, when you boil that and you drink that, that's everything that you're getting. So we need to be careful when we're taking these things.
And especially if you're taking medication from a doctor.
Exactly.
All right,
exactly.
So you might not be able to combine something with fever grass and something with Vervine.
Indicate each other. We need to know that.
Now, I got a text message here without even advertising the number, and I will mention it now. The number, if you have a question for the nurses, 607-6777. Somebody wants to know at what age can someone take ivermectin? I guess they're asking if it's for children or only for adults.
Again, like Nurse Lisette mentioned, it is advisable that the person seek medical advice. Go and see your medical officer. If that child needs the medication, that child will be put on it, right? But if the child does not need the medication, the child will not be put on the ivermectin. But we need to advise the public that they need to seek medical advice before taking these medications.
Okay.
And more than just the age, it has to do with the weight of the child, because that would give you the kind of give you a balance as to how much the child can take, because your body has to get rid of it, right? And taking too much, it will just increase your toxicity level, right?
Okay. Somebody asking here again, where is testing for COVID-19 done in Toledo?
Right at the flu clinic. Right at the flu clinic on the hospital compound, the test is being done.
And this test that is being done, how quickly do I get the results? Is it the same day?
Okay, if it's the rapid test, and the rapid test has a criteria, has two criteria. If you have been in contact with somebody that has COVID within 5 days, then you're more than likely, and you're having signs and symptoms of COVID, then they will do a rapid test for you. But now they will do two. They will do the rapid test first, and then they will do a PCR. If the rapid test came back negative, they will do a PCR. They do PCR, but that will take a longer time, like 3 to 5 days, because that is done in Belize City. But rapid test is done here at the hospital compound.
Last month, I believe you all were doing some villages. You went out to the villages. What was the response to that, and will it continue?
Yes, it is. Today they are in Cricket Circle doing more testing. The mobiles continue, because then we need to reach the population that are not coming in. Because then some people do have the virus, but they are scared to come. So we go out to the villages to do the mobiles for the swabbing. And that is being done with the rapid test. If they need to do the PCR, then yes, they would send up the swab to Belize City to do the PCR.
Now, do you have a schedule? You said today you are in Cricket Circle.
Today they went to Cricket Circle.
Is there a schedule going forward? Today is the 25th of January. Do you know for the next few days where you'll be? Or
We have a Facebook page that covers PG Town and also San Antonio Rural Villages. So on that Facebook page, Toledo Health Service District Health Services has a Facebook page that if you log on, you will be able to see when and where we're going and when, because we cover the whole district. We should be going next week to San Benito Puente on Thursday and Friday San Vicente.
Okay, somebody else asking here, what about the situation with, okay, I think the point or the gist of this text is asking if they live in Toledo, can they be tested at another hospital elsewhere in the country, another health facility?
For sure. If they live here but they're not here right now, for sure, wherever in the country there are clinics just like the one in Toledo, in every other district also.
This text message here is asking, is COVID transmittable from mother to child?
Well, research has been done, and there is no evidence base yet to say that yes, it is transmitted from a mother to the child before birth or during delivery. No, there are no evidence to say yes so far, but they are still doing research on this same topic that you have brought up.
This other text message here is saying, we have a lot of mosquitoes. Is there a test? Do they do testing too for dengue and malaria?
Yes. We mustn't forget that these other conditions are still within our country, and we cannot neglect to not look at that and just focus on coronavirus. So yes, I thank the viewer for mentioning that, because now we just got a memo saying that we should continue to also do surveillance for dengue and malaria, because as you know that Belize is seasonal. This is a seasonal condition, right?
And I guess to follow up on the person who texted this in, I note as well that there's been an increase in mosquito at this time of the year.
Yes.
I don't know, it doesn't fall under your remit, but do you talk with your colleagues over at Public Health and say, do at least spraying for it?
The thing is, the spraying is done when the weather is good, because if it's raining and they spray, the effect will not happen because of the weather, no? So when it's not raining, that is when they would spray.
Okay, so that
weather has a lot to do with the
that might be a reason why, because it's been raining a lot in the Toledo district.
Exactly.
So, okay,
Exactly.
all right. Now another message here says, how long after a positive test before a person is declared safe? I don't know. They didn't finish.
Probably safe to go back to work.
They didn't finish the text, but I think maybe that's what they're getting at.
Yes.
You want to take that, somebody?
14 days. So once you've been tested positive, say today, then you are expected or recommended to stay in quarantine for the next 14 days. And after you've completed those 14 days, if you are asymptomatic, means that you don't have any symptoms, you are allowed to come out, to go back to work, to be in your community actively, and come out and do your shopping, do whatever you need to do now. 14 days.
But let me ask you this. If I go in today, the 25th of January, and I test, and it comes back and I'm positive, beginning the 25th, 14 days forward, but what happens to the days before up until the 25th when I tested positive? How do you calculate that 14 days? Or when I test positive, is there any way to say how many days before the day I tested positive that I was positive?
There are some people who can calculate their exposure, but not everybody. So that is a generalized thing we do. Some people, we know that they have had exposure, right? So for example, we're working together. She tests positive. Automatically know that my exposure was her, but not everybody knows that. So whenever we do an interview, we would ask, have you been exposed to this person? When was the exposure? So from that we can calculate. But for most people, they will not know, because the virus is so common now that people get infected and they don't even know who they were exposed to. Right?
And this is the reason why they say 14 days after the day you have been tested, then you will be declared
Yes.
safe, no? Okay.
But I guess for those people who know when their exposure, then you can count the
Because
14 days for them.
they are also saying that, well, studies have shown when somebody has signs and symptoms, they have been infected at least 3 to 5 days prior to having those signs and symptoms.
Now, what do you say to folks? Because I know there are people who I talk with, including family members of mine, and they are almost deathly afraid to get on a bus to go anywhere. But yet we see the protocols don't seem to be applied strictly to buses or public transportation. How safe are our public transport system for our commuters, for people to be moving around?
I commute every day, and I would tell you that the reality is that you will sit beside somebody. I mean, yes, you're wearing a mask. Some would offer you hand sanitizers, some don't, right? But for the most part, we cannot. Well, for the Toledo district, I don't think we ever had linked an outbreak to a certain bus runner or something like that. So I up to now, based on that, I would say that it is safe enough, just because we don't have the evidence to link it to a transport-based things like that, you know.
Okay.
We would maybe it would be more like a family, right? Contracting it from a family or a frontline worker or a nurse or a patient come and bring it into a health center.
Okay. Now, do we have, when you go on your clinics, is there an outreach? Like for us in the church, we have an outreach when we go to the villages, and because we're a church, we tell people about God, the Bible, and things like that. Do you, as medical practitioners, do outreach where you go into the villages and talk to the people about how to be safe and what to do and all of that? Is that kind of outreach from you all?
Usually when we do our mobiles, we need to do health education with the public, with the community members, no? So we also do that, especially that this pandemic is on. We will talk about wearing because when we go out in the communities, we advise the mothers, the fathers, whosoever is coming to the mobile to please wear their mask, practice social distance. Even so, since the pandemic has started, when we do our mobiles, because we used to go to the community centers or the health posts, and the mothers would come to us. But now we do home to home, house to house visit. Okay. Instead of having them, gathering at one area, because we know it will be very difficult for that social distance to be practiced. So we do house to house visit to do the vaccine, and we still inform them about COVID and practicing the safe practices that they need to do, wearing their masks and hand washing and things like that.
Now, the next couple of text messages we got actually preempted so instead of asking the text message or reading a message, I will ask the question before, because two people asking about vaccination. Is there a vaccine for COVID-19? So I'll let you talk about that, then I'll see the other part of the question having to deal with that. So is there vaccination available in Punta Gorda for people against COVID-19?
Okay, there is a vaccine available, but not in Belize, right? They have, right now there is 2 vaccines that are given in the United States and other part of the world. The Pfizer vaccine and the Moderna vaccine. Ministry have procured vaccine, should be in country by end of March, early April. The first people to be vaccinated when the vaccine comes in country would be the healthcare workers. And it doesn't matter what category of staff you are, as long as you work on the compound, you will be vaccinated. Right? You should be getting the vaccine. That's your right. Then the second category of people that will be vaccinated after that would be the persons with chronic conditions. Those that have diabetes, high blood pressure, asthma, cancer, things like those. Who are immunocompromised will be the second persons to be getting the vaccine, and then the third set of people will be the elderly. Because most of our elderly, we know that they are frail, and if they get the condition, they might end up losing their lives. So we want to protect them also. And then after that, we'll be looking at the other rest of the population. Those are the healthy people.
Now, so the earliest that Belize will see anybody vaccinated, you're saying, like, let's say around Easter,
Yes.
the middle of
In
April.
yes.
Do you foresee that the general public then will be able to start having access to this vaccine anytime soon?
Yes. Once the vaccine is in country and the people that are specified as priority groups are vaccinated, then yes, the vaccine will be available for the rest of the public.
Having or seeing what are some of the early reaction abroad, people getting some severe reactions, even dying. How confident can you tell Belizeans they will be that when you jab them with a needle with this vaccine that they'll be okay?
Usually when we give vaccines, we have what we call the adrenaline. We have an emergency kit that we usually keep along with us, even when we go into the community. So that if anybody has any reaction, we would give them the adrenaline and that will combat the reaction.
Okay. Now, and these vaccines that are being procured for Belize, that Belize will get, it's not like I will be able to buy the vaccine, right? It's for free for the people,
yes,
right?
It's free. It's free.
After you've been given this vaccine, after you're vaccinated, does it mean then that, okay, I can finally throw away the mask and start going out and having fun again?
No. We would like at least 95% of the population to get vaccinated. But even if you have been vaccinated, because it's 2 doses that you should receive, right? The first dose, let's say you get it today, then within 28 to 12 weeks after, the second dose will be given. If 95% of the population have been vaccinated, then we can go back to what we call probably a normal as before. Because right now we are in the new normal, right? But we still would advise people that they need to still practice social distance, still wear your mask, and still keep on washing your hands properly.
Okay.
And wearing the mask, when I say wearing a mask, I don't mean that you'll under your nose, over your nose and your mouth, right?
Yeah. Now, I mean, this, I commented publicly to somebody, it took COVID-19 to remind us what they used to teach us when we were little, wash your hands and good hygiene and what have you. Now, this vaccine or the vaccinations will happen in Punta Gorda town at the hospital, right?
Yes. It will happen at the hospital, and we will also be doing outreach in the villages.
Okay. But you say like the frontline workers and the group most at risk, those will be up front, those right off, right?
Yes.
So you all will determine then who are the chronic patients that will be able to get it, right?
Actually, the Isabel Palma Polyclinic and the Punta Gorda Polyclinic, we have the list of all the chronic patients that seek medical attention. So only persons that we don't know about are not on that list. But everybody else are. So far, I think it's 1,600 and something chronic patients that we have for both areas that are registered.
So basically, you already know how many people, how many injections you'll have to prepare beginning in April.
For the chronic patients, yes.
For the chronic patients.
Yes.
And for the frontline workers?
Yes, because we have the list of frontline workers, and we have been liaising with HelpAge and other organizations that deal with the elderly so that we could get a list from them for the elderly patients.
Okay. The second half of the question that the person asked, preempting the question that I asked, they are concerned, is there an alternative if I do not want the vaccine?
Like all our vaccinations are under consent. We have had challenges with people accepting the regular vaccines we have. So we know that COVID-19 vaccine will be no different. So it will be on a consent basis. People will have to know their risk and then decide for themselves and their family who is going to be getting it. Right? So it's not something that is going to be enforced. The health education is going to be given, but it's family who is going to be making the decision.
Okay.
Yes.
I see particularly on social media where people are friends, I guess, call themselves friends, advising friends, don't take that vaccine. I mean, right here in Belize, we already have people already saying, don't take that vaccine. How do you counter that kind of narrative that is already out there? Of course, these big international companies, they're rushing to get a vaccine so that to try to thwart the further spread of this pandemic. But already in advance of it arriving in Belize, the vaccine, we're already seeing people saying, why not trust that, don't take it.
We know that whenever we have something new, there's always going to be change. Change always brings, opinions and discussion, and it's good. We need to talk about these things. I like people who like to challenge, but at the same time bring your facts, because that's the way you can talk about things, right?
Yeah.
But for the most part, I would ask Belizeans, get educated. A lot of times we expect Ministry of Health or this association, organization to bring information for us. We need to get educated in what is happening in our country and what is happening outside the world, and then we make a decision based on facts, not on what that person is telling me. And we have to make sure our source is reliable and it's something that it's, we can say, oh, yes, I can follow this.
Yeah.
So just get educated. Yeah.
Now, on that same vein, can I ask you, is there a focal point? Is there a website? Is there a phone number? Is there a hotline where people can call at their own leisure and ask basic questions like this? Because we know it's not everybody that will have access to the media and social media like we're on right now. But is there somewhere where people can come and get the right information, accurate information, so that they can make a decision that won't end up hurting themselves and their families?
Okay. We have the polyclinic in Toledo and Punta Gorda. We also have polyclinic in San Antonio. We always welcome people calling, because when we get these calls is when we look at our services, and then that tells us what type of services are we offering. Because then if we're not meeting the needs of and the demands of the population, that is how we can improve, right? So we encourage people to call in. Maybe I could give you the clinic numbers.
Yes.
So for Punta Gorda PCP, it's 7220030. Sorry. 7220030, and for San Antonio is 670-6368.
68.
Yeah.
Now, these numbers, are they manned 24 hours?
No, but we do have. I don't know if
But,
to share.
but when they call the polyclinic with that number, if they want to know more about whatever, then they would direct them to where, they would transfer to the area that they need to get that
Right.
information from.
But
And
you're
we do have people who answer call 24 hours. We do.
Okay.
We have to call
We
for
have to be
24
on call
hours.
for 24
It just depends on which area you're working at. But each department have people who need to be on call, especially now to be on call for 24 hours.
Okay. Getting back to the text messages, somebody wants to know that it says the nurse mentioned about symptoms, but what if you don't have any symptoms and you feel like you have COVID?
Even if you don't have any symptoms and you think you have been in contact with somebody that has COVID, you can go to the flu clinic and you will be tested, even if you don't have any symptoms.
What do you do about people who are asymptomatic? People are walking around healthy and laughing, smiling, and they don't know that they're COVID-19 positive.
Okay, and like I said before, because most people don't have any signs and symptoms, and they don't know that they are, affected. But if they know that they have come in contact with somebody that has the virus, because, if somebody has the virus, they will share amongst whosoever they have been with,
Yes.
and they will say, I have been tested and I'm positive. That person now should take that initiative and go and get tested. That's the best way you can find out if you have the virus.
Okay. I guess a follow-up to that same question is, let's say I'm asymptomatic. I don't know that I have it. I feel well. But I can still walk around and pass it to my wife, my children, my grandmother, my mother. How?
And that is what has been happening, and this is the reason why we have, increasing cases. Because some people don't know that they have had it, that they have the virus. Because they are healthy, they don't feel any way, they don't have any signs and symptoms. And going around, you are at home, most people don't wear masks when they are in their household.
Yeah.
And that is how other people catch the virus. So, okay, we would advise people that Now they are telling us as healthcare providers that even in the house we should be wearing our masks. Because, we are working, we have people coming to us, the general public comes to us for help, and we don't know who have it or who won't have it.
Okay.
So because of being a healthcare provider, going back home, we ourselves should be wearing our masks in our household.
So that's a recommendation, but it's not in practice in Belize right now.
No.
But do you foresee that it will become something that's necessary in Belize?
Probably, yes.
Because you all are on the front line. Okay. Now, when you start the vaccination, will it be done in phases, or on day one you'll say, okay, we'll vaccinate 1,000 people all in one day?
No, it will be in phases. The first phase is for the healthcare providers, like I mentioned before, and then the second phase will be for the chronic patient, and the third phase will be for the elderly, and then after that it will be the other healthy population.
Okay. Let's say we have Belizeans abroad, and they somehow are fortunate enough to get the vaccine abroad or get the first dose abroad, and then they come home. Can they then get the second dose at home?
Well, I think usually they would give a card, because I know for us here in Belize, we usually give a card, with the date that you get any vaccine, because you have to have a record. It's in the system that we use, the Belize Health Information System. So if they bring a card and they have evidence that they got the first dose, then I think it won't be a problem for them to get the second dose.
Okay. Now, let me try to understand this and explain to our viewers and our listeners as well. It's 2 doses that you have to take.
Yes.
But the 2 doses are the exact same things.
Yes.
So why don't give 1 dose, or explain that?
The protocol stipulates 2 doses to be fully immunized. So you need the 2 doses to be fully immunized.
And
1 dose will suffice for you for the immune to fight off the vaccine or prevent you from getting the vaccine.
now, when I get this,
The virus,
The
virus, sorry.
yes, when I get this vaccination, how long does it last? Is it a lifetime thing,
If
or?
you get the 2 doses?
Yes.
Yes. Yes, it's for the rest of it. So it's as some of the routine vaccines that we do, it's the same thing.
Now, what do you say to those who, and we already have it in the media reported that there are different variants or different strains of the coronavirus. You're telling me that there's one vaccination that will begin in April, will cover those as well?
Well, I just heard in the news that yes, the vaccine that are being offered also cover the new variants of the virus that is out for the pandemic. I
Wow.
heard that in the news.
Wow. Okay. And that's coming from the CDC, the Centers for Disease Control.
Yes.
Wow. Now, these 2 vaccines that that we're getting, or which one we're getting?
They are looking more forward to the Moderna.
Moderna.
Because the Pfizer vaccine, there are some conditions that we don't have in the country to keep the cold chain.
Okay.
So the Moderna has, it is less sensitive than the Pfizer vaccine, because the temperature that we have, it can't maintain the cold chain for the Pfizer. So they are looking to the Moderna instead of the Pfizer. So that we know that we are giving something efficient, no?
Okay, now I don't know if this is above your pay scale, if you want to call it that, but the vaccine that we are getting, is that through the Pan American Health Organization, or the government of Belize, the Ministry of Health, buy these from where are we getting the vaccine
Actually, Pan Health Organization, yes, is the one that is procuring the vaccine for the country of Belize. I think it's the COVAX group of companies that they are looking for to get the vaccine. No?
And you're hoping that the 95% immunization that you're hoping for Belize, is there a timetable as to how quickly you expect to get 95% of the population vaccinated?
Yes, within 6 months.
Wow.
Within 6 months' time.
Is that a reachable goal?
This is for the group stipulated with first phase, second and third phase within 6 months. Then the other population will be those will not be vaccinated within 6 months. They will have to be further down in the year.
That is what I'm asking.
Yeah,
so for the frontline workers and the chronic patients
and the elderly.
within 6 months.
Yes. so that they can get both vaccines.
Who qualifies as an elder? I mean, if you look at me, I probably more gray hairs than you. Am I elderly? Am I an elder? Can I get the vaccine?
It depends on the age, because we elderly, anything from 60 and above.
So for the Ministry of Health, for Toledo Health Services,
yes.
60 and above, that's
yes.
elderly.
Yes.
Oh, okay. So I just want to make sure, because I don't want to surprise one to see me down or get the coffee my vaccine, you know. All right. Now, in terms of wow, that's even ambitious, because Toledo district is how many? 1,200, 1,500?
You mean the district?
Yes.
No, it's 24,000.
The group, the people you're getting.
Oh, the frontline workers, you mean?
And the vulnerable groups. How many people? You said you had a roll of what?
Yes, the chronic patients were 1,644.
All right, so that's for Toledo alone. And let's say you still have Stan Creek, you have Kai or Belize or Ridgewalk, and their role might be bigger than
theirs. Will be more than ours.
So I am sure that 6 months is for Toledo.
Yes.
Or for Toledo.
Not actually.
Not for the whole country.
No. For the 6 months is for the groups that we said before. The frontline workers, the elderly, chronic patients. Within 6 months, the country want to reach everybody, those people within 6 months.
All right.
All the districts.
All right.
Within 6 months.
And then in terms of getting everybody, the rest of the population, you see this will run into next year.
Yes, probably, yes.
So definitely 2021, we're not going to see majority of our population getting vaccinated. Wow, okay. Let's go back to some of the text messages, because these messages keep coming in. Somebody is asking here, the variant that is in Europe is different from the variant in Mexico. How can the same vaccine work on both when there are different variants? I guess
the thing is, they have done research, and that is what the specialists are saying, no? The scientists are saying that the vaccine will work for the different variants that are out. So they have done studies.
Okay. Somebody else is asking, I am taking fever grass. Will you give me the vaccine with my fever grass? So somebody wants to know, they don't want to give up the fever grass, but they want the vaccine.
We're not saying that you cannot take your herbal medicine, right? If that person fit the category we just said, and that person decides to take I take fever grass, right? I don't think there's no conflict. Because we've been drinking fever grass for long now. Right?
Yeah,
right? And ginger with garlic.
Yes.
I don't think that would be a problem.
Okay. Now, are the healthcare workers being trained on administering this vaccine, or is this just a part of the normal for them?
We are trained. We are trained to give the vaccine.
You all are trained as nurses to give vaccines on a whole, right?
Yes.
But there's no difference with the coronavirus vaccine.
No different. The public health nurses and the rural health nurses are the ones that deals with the vaccines.
And because of the population, it's larger than what we normally would work with. We have other nurses who will be getting trained, and medical officers if the need arises for them to administer the vaccination.
Because the age group, the population for the vaccine to be given, children, it have to be 16 and over.
Oh.
Or over 16. It's not for younger than 16.
Okay.
So, and you know that our population, our target population are 0 to 5 years old. So, yes, we will be assisting when it comes to the vaccine, but it's mostly the outpatient nurses, the doctors, they are the ones that will be dealing directly with the vaccine. But we will be assisting. No?
I'll get back to the text message, but let me ask this, because I know a part of the protocol announced by the Ministry of Health is that children under 6 years old, they don't have to wear a face mask. Why is that? I mean, aren't we all at risk, even a 4-year-old?
I think the risk comes when you wear a mask and you can't explain to the child why. So for you to have a child wearing a mask and then the child will be playing with it, drop it on the ground, not knowing what benefit of wearing a mask, and it's best the child doesn't wear any at all. Just for you to not have that risk there. And also we have had babies, like nurse was saying, they bring the babies to the clinic, and then while a baby cannot wear a mask, the other risk is that they are carriers, because maybe the adults are wearing a mask, but the child doesn't have a mask, so they are exposed and they can be transmitting the virus, and they wouldn't even know who the child get it from.
Okay.
Right? So the risk is that the child will not be able to mask properly at every time, right? Because you understand what's a mask
What's
for?
the benefit?
They think it's a toy, so it's more risky for them to have it on and then properly use it, right? So I think at 6 years,
And some of them will be sharing, no?
Yes.
You wear mine and I wear yours. And for children 2 or less, it is not recommended because they, you know, so it's not recommended for children 2 or less.
Somebody is asking, can the nurses explain, you all were advertising for people to be medical technician in your clinic. Is that still going, and how can they join? I guess I think I saw an ad that the ministry was,
For ministry level.
so it wouldn't be for you all.
No, that's
it's
ministry level.
right. But the contacts are there. The information needed to submit and to make the contact, it's right on the flyer.
Okay.
So probably they can call that number and
Right.
get the information that they need.
Asking again, is there anything the nurse mentioned about the drug to counter any reaction? Is that the only counter thing that they that?
Not really. We
I
also
think
have
you mentioned, what was it? Adrenaline.
adrenaline, yes.
Yeah.
We also have the hydrocortisone and the Benadryl that also assists with countering allergic reactions, no?
This person says, I went to the clinic. I had a cough and I was sneezing, and they told me that I was all right and I did not need to get a test. What do you respond to that?
I'm not sure, because if somebody is having cough and cold, you know, then I think they should be directed to the flu clinic. So it depends on the evaluation the doctor did at the flu clinic to have him decide that the patient doesn't need any tests.
Okay.
The information given to
Okay. Somebody is asking, how updated is your health information system? Do you truly know how many chronic people you have? What about those who do not go to the hospital for treatment?
You see, that is the thing. If they don't go, we won't know that they are chronic. But the health information system, once you seek care, the doctors will enter your diagnosis on the system, and then you will pop up as a chronic patient. But if you don't go to seek the care at the health system, then we won't know that you're a chronic patient.
So how do you count? You say you have, what, 1,500? There might be another
Exactly, and that
couple
is-
hundred out there.
And hence the reason why we advise people not to be taking herbal medication, but to seek medical attention. Because if you seek medical attention, you'll be getting the proper medication for your condition, and then you will be a part of the system.
Okay.
And
Now-
for this one too, sorry, you don't have to be a member, because you know for both clinics, because of NHI, you have a list and you have been registered a member. For the vaccination, that will not be a criteria. That you
Okay.
have to be registered as a member. It will go across the board. I guess the requirement would be you're chronic, and you reside in any one of the villages or any of the town, right? to get vaccinated.
And the thing is about being a member or a non-member, because a member is a valid social security card and you are registered under this polyclinic, you will get the services after. Whether you're a member or not and you seek care, you will be attended to.
Okay. Here, and I don't know that you all will be able to answer this, but let's give it a try. Somebody is saying the borders are closed, but what about people who get treatment across the border? They might not be registered in your health system, but they are still elderly.
Well, we know that used to be the reality of border villages, because people choose to go where they want, where they feel more comfortable, and where their finances can take them. So that is the truth. Now the borders is closed for a fact that some people still go across, and that is their choice. But once you're a resident of Belize and you're Belize, and the ministry will get, ensure that they get vaccination for each member of each community. It's not that to tell you, okay, because you're not coming here, we won't give it to you. You are a Belizean, you are afforded that opportunity.
Okay. Can the nurses say how many doctors are on duty in Punta Gorda? Do we have enough doctors to meet the patient?
Actually, we don't have enough doctors and we don't have enough nurses. That's the reality. But with the amount we have, we try our best to give the patients the care that they need.
Okay.
But the reality is we don't have enough doctors, we don't have enough nurses in the country of Belize.
Somebody is asking, could you please repeat the numbers where we can get help?
Okay, so the numbers for Punta Gorda is 7220030, and for San Antonio Polyclinic is 670-6368.
Somebody else is asking, and I don't know, well, you might want to tackle health professionals. Is the curfew helping or hurting the nurses' work?
The thing is with our profession, if we have to work, we have to work. Right? So the curfew, because whether people come or people don't come, we have to be there to serve whosoever reach or we have to be on the job. So it's not hurting the job. We still do what we need to do.
Okay, somebody asking here via text again, and they're saying, Belize on a whole has obesity. How do we, in this day and age of COVID, deal with that situation? Because we're putting our efforts into COVID, and the obesity continues to go unchecked.
And that's very important, because I think you made a comment earlier that it took COVID to teach us we need to wash our hands and how frequently we wash our hands, right? So I think it also brings another thing to the surface. I mean, it has been in the surface, but maybe we kind of wanted it to go away, right, on its own. But we know that chronic condition, the way we eat, the way we exercise or don't exercise, our lifestyle, and this is what I think should come to the surface, not only for the Ministry of Health, but as an individual, me, myself, as a person, how am I living? How am I taking care of this body so that 2-3 years don't virus come, right? How will it affect me?
Exactly.
So I think as an individual, we need to think, right? We need to make some lifestyle changes, for sure.
Yes.
And this virus has just brought up everything to the surface that we already knew, but we're not paying attention to.
I think it's not just the talk about obesity,
Right.
but it's not only obesity that is a lifestyle thing. I mean, there's diabetes as well. And there are cardiovascular issues,
Smoking.
right? Smoking, all right? And the whole thing is we are using COVID now and the lockdown or the thing as an excuse. Oh, I can't go out because, right here at the studio, we had to come up a whole flight of stairs. And there's another flight going upstairs. But I can use that as an excuse, as an exercise regimen, right? And not because they stop you from going to the park or from playing football or baseball or basketball, that means you're going to sit at home and get fatter and fatter and things like that.
I think I heard a term, potato couch or a couch potato, something to that effect, right? Because that is what COVID has done for us.
Yes.
We're sitting in front of a television and we're comfortable.
Yes. Yeah, but we're comfortable there until the diabetes kick in,
So,
and then that made you use the same diabetes to get to it and things like
So
that.
I know that most Belizeans, we don't live in apartments, thank God. We live in homes where we have yards.
Yes.
And for some of us in Toledo, we have big yards. So we need
Yes.
to begin using the yards more, right? The kids are at home. They're not at school, they have the time to do their schoolwork, whatever. This is the time that we need to, maybe we don't have, for those who work, we may not be able to do it every day, but at least make it an effort,
Yes.
to come out in our yards, play some game, walk around, do different things.
Right, you walk right up and down the street 5 times.
Right.
That's a means of exercise.
Well, I would encourage people to do that as well, but just not talk to you about it. Because then you become our next issue, we have to grab them and bring them at you, because then when they answer themselves on the street,
Let's
right?
just sing, right?
Yes, sing. I would recommend the singing. Don't ask the question and try to answer it, right?
Sing.
Nurses, we are out of time basically. I mean, time flies when you're having fun. I mean, we could do this, but I'll give you each closing words. And I want to remind our viewers that we'll be back next week at the same time. It is going to be an ongoing program. And you can always, if you have a question you want to ask the nurses, text it to 607-6777. I'll pass it on to them. If these two nurses don't come back next, their colleague, and then they'll share it with you right here. But your parting words today.
I think coming to 2021, for me personally, I've just to look at where we are in this country with what we had been hearing before about COVID. I'm so grateful, right? I deeply touched by people who have lost people to COVID and things like that. But I'm so grateful that it has not touched our nation as what we have seen, as what we had envisioned.
Yes.
So first of all, I am very grateful to God that I'm sitting here. We're sitting here, we're having
Praise
this
the Lord.
conversation. So I'm encourage people that God has given us a mind to think, right? And for us to make wise decisions and for us to live differently, We know that fear has gripped a lot of persons, but there are so many things that we can do. As you rightly said, exercising, know that we have been closed up in our homes, but I mean, media, social media is good and it's bad, but we know that many connections have been happening because of the confinements of where we have been. But thankfully, I just say that we are a blessed nation. We've said that so many times. This 2021 really has showed that we are a blessed nation, and we just have to be grateful to God for what He has done.
Praise the Lord.
I just like to inform the general public or advise the general public. Let's do the right thing. Let's practice our social distance. Let's wear away. Let's wash our hands frequently. If you don't have water and soap, use the sanitizer. And please, the sanitizer still does not replace the washing of the hands with the water and soap. It's very important that we take care of our health. We take care of ourselves because we only have one body. And our body is the temple of God. If we don't take care, no one else will do it for us. So let's do the right thing and take care of ourselves. If you know you don't feel good, visit the clinic. Visit the clinic so that you can be checked out to see what is happening. That's the only way that we will know what is happening with us.
Okay. And on that note, we are going to call it a day for this edition of Your Good Health. Thank you for joining us. We invite you to join us next Monday at the same time for another edition of Your Good Health.